Hello everybody, I hope you are having a wonderful day. So in your last video of the digestive system, we are going to cover your liver, and the accessory organs like your liver and pancreas that you need to know about from lower on in your digestive system. Your liver is going to be the main one we're going to focus on today because it just does so much for you. But you will need to know about some of the diseases that come from your pancreas, because of course you guys know about diabetes, right? So your liver is technically the largest gland in your body, right? It's about 3 pounds. Your liver is pretty huge, right? It's just underneath your diaphragm, and it has 4 main lobes to it. You have the right big lobe, the left lobe, the caudate lobe here in the back, and then the quadrate lobe, right? So you have caudate lobe and quadrate lobe, right? You guys have got to know the hepatic portal vein and the other veins inside your liver, right? We know that the common hepatic artery brings nutrient-rich blood to your liver to feed your liver, right? And keep your liver going, because your liver is your body's poison control center. You don't want it to starve. And we know that the common hepatic vein takes all that used blood back to the inferior vena cava to go back to the heart to be reoxygenized and go back into service. But you need to know about the hepatic portal vein as well. The hepatic portal vein is the vein that is bringing blood that has absorbed nutrients from the small intestines and large intestines to the liver, so that your liver can poison control check it before it goes, like as a pit stop, before that blood continues on into the inferior vena cava and goes on to the heart. So the common hepatic vein is what dumps everything back into the inferior vena cava. But the hepatic portal vein is bringing the blood from the intestines to the liver to be filtered. You guys need to know the difference between the two of those things. They always ask a question about that on the final exam. Right? So your liver, the way your liver works is the interior of your liver is divided up into lobes, or little lobes called lobules. Right? They are hepatic lobules. Each and every lobule has a vein going down the center of it called a central vein. And that is going to be surrounded by cells called hepatocytes. Right? Between the central vein and running through all the hepatocytes are going to be channels called sinusoids. And those sinusoids are going to have lots of little helper cells in it, like a special kind of macrophage called a Kupffer cell, that are going to help eat bacteria that may have gotten into your bloodstream through digestion. Yeah. The outer corners of each of these lobules, because they are shaped like hexagons, that is a stop sign shape. You're going to see a little vein, a little bile duct, and a little artery. Those are called portal triads. So that's going to deliver a little bit of extra bile, artery blood to feed these cells, and the veins to this area. And within this area, those veins from the hepatic portal vein are going to dump the blood that needed to be filtered down into these sinusoids. And the sinusoids are just going to, via the hepatic cells, they're going to filter anything that needs to be filtered out of that doesn't need to go to the rest of your body. And anything that is found wanting that does not need to be sent on is going to then go into those bile ducts and be released back into your small intestines, where the bile ducts, like in the duodenum where the bile ducts attached, so that it can leave the body as waste. This is also how your liver helps filter dead red blood cells and all that kind of stuff that we have discussed in previous units for other jobs the liver does. Right? So you can see the individual lobules with the little central vein in the middle of each of them. The central vein is what's going to dump back into the hepatic veins, which is then going to go on to the inferior vena cava. So if it makes it to that central vein, it's good to go, and it's going to go on to the rest of the body. If not, it's being filtered out, and it's going to go to one of the bile ducts to receive the waste that's in the corner of these lobules. Right? So that's basically the function of these hepatocytes. After the meals, they're going to absorb excess glucose, iron, amino acids, and fat-soluble vitamins. Between meals, they're going to break down stored glycogen. Right? They're also going to remove and break down hormones, some drugs, red blood cells, bile pigments, toxins. And when I'm saying drugs, I mean like your liver is what breaks down alcohol. Your liver can only break down about an ounce of alcohol an hour, which is when you exceed that is when you get drunk. Other drugs, such as ibuprofen, is also processed and secreted out by your liver. Things like Tylenol are secreted by your kidneys, which is why if you have liver problems, they tell you to take Tylenol and not ibuprofen. But if you have kidney problems, they tell you to take ibuprofen because ibuprofen is filtered by your liver, Tylenol by your kidneys. Your liver is also going to secrete some lipoproteins, clotting factors, other good things like that. Right? And your liver makes bile. It's one of its main jobs. It filters all of this stuff and it creates bile. It's going to create a green alkaline solution that is going to contain bile, cholesterol, and phospholipids. Right? Bile salts emulsify or soften and break down fats. So that means these chemicals go into like overdrive mode when you've eaten a super greasy meal. Right? They are going to break large fat globules down into smaller droplets with larger surface areas so that you can break down fat and grease. Right? You are going to recycle your bile salts because the ileum will start to reabsorb them before they hit your large intestines. You also create a pigment called bilirubin, which is secreted by, or it is a byproduct created by dead red blood cells, and it's actually what gives fecal matter its color the majority of the time. If your body is not making enough bile, your feces is going to turn gray and fatty, meaning it's going to be runny like oil, unpleasant, and it's going to be more gray in color. That's a good sign that your liver is not doing its job and you have a problem. Please see a doctor if you see that kind of thing in someone or yourself. Speaking of which, your liver is prone to some diseases. It is your poison control center. Bad things can happen. Sometimes you will have a viral infection called hepatitis, which will cause inflammation of your liver. See how inflamed and swollen and not good this liver is in that one? Right? Your liver is normally supposed to be happy and pink and smooth like in these first pictures. Look at this happy, smooth liver right here. You don't want it to look like this. This is not healthy. No bueno. Not good. Right? Hepatitis can be a viral infection. It's inflammation of your liver because of a virus, basically. You guys know about different types of hepatitis. Most people are vaccinated against them because there are vaccines for them. Hepatitis A, B, and C. I know before you can work within most healthcare systems around here, they require that you have your Hep B vaccine, and hepatitis B is a 3-round vaccine, and they will not let you start working there until you have had at minimum your first 2 rounds of the Hep B vaccine. Hepatitis C can also be transferred via needles or sex, so Hep C can be a sexual transmitted disease. Hepatitis A you can get by eating raw oysters. So I would not recommend eating raw oysters. But you can also get any of these hepatitises by blood transfusions. Cirrhosis, right, is a progressive chronic liver inflammation and disease and disorder. So this is a cirrhosed liver. It's a lot of scar tissue building up from that chronic inflammation that just keeps happening over and over and over again. Cirrhosis is normally attributed to alcoholism. So if you know an alcoholic, cirrhosis could potentially be a side effect of this because your liver is the only thing processing alcohol. And if you're an alcoholic, you're drinking more and more and more alcohol to get the same effect. But your liver is not processing alcohol faster because you're drinking more and more and more. It is still trying desperately to do its job, but it can only do its job so fast. And that's going to lead to inflammation and scar tissue, right? It can also be caused by chronic hepatitis flare-ups. And when you see this kind of thing, the liver is going to become fibrous and fatty, which means it's not going to be as efficient and its activity is going to start dropping. If your liver starts becoming fatty and having less activity because of scar tissue, that may obstruct flow through the hepatic portal systems and whatnot, and you may end up with a distended liver like this individual here because they end up with a lot of fluid distended and pushing against their liver. Imagine a beer gut on steroids. It's not pleasant. As your liver stops working, it's not going to be able to filter bilirubin out of you anymore, which was a pigment caused by dying in dead red blood cells. On individuals who are paler, like our pale white pasty folk people, you'll be able to see this effect quicker. Because you can actually see buildup of bilirubin as a color because it is a pigment from under your skin, but it takes longer to detect in our African American individuals with darker skin tones. So this individual here has a failing liver, and this is a close-up picture of their eye. You can tell that the whites of their eye are turning yellow, and their skin tone is also yellowish. That disorder or coloration is called jaundice, right? Jaundice is generally the term we use for your liver is not doing its job well and bilirubin is building up inside you, so you can start telling this color difference. As you can tell, that kind of slight yellowish tinge to the skin would be harder to detect in an individual that has a darker skin tone. But if an individual has, if the whites of their eyes have turned bright yellow like that, see a doctor, your liver needs some help. So jaundice can be caused when your liver is affected by any of these disorders and diseases. I've been asked about babies because some babies do have jaundice, right? Normally, unless your doctor is worried about your jaundiced baby, I would not worry about that. Your doctor is going to tell you how to deal with that. The reason why sometimes babies are born with jaundice or they are a jaundiced baby is because before coming out of mom, the last two organs during the third trimester to form are the liver and the lungs, right? That makes the most sense when you think about their functions. The lungs are so you can breathe in the outside world and with air, and the liver is your body's poison control center. If you are a baby or a fetus inside your mom, depending on the stage of development, you don't need to be able to breathe outside of your mom if you're still inside your mom, so there's no point in developing the lungs earlier than last, right? And you don't need a poison control center for your body because you're not the one ingesting anything. Your mom is ingesting everything and then passing the nutrients on to you via her blood and the umbilical cord. So you don't need a personal poison control center in your body yet, but you will when you enter the outside world outside your mom. So because of that, the two last things to fully form in babies are the liver and the lungs. This is why when we start talking about preemie babies, we are normally worried the most first about how well are they breathing? Can they breathe? Do we need to put the itty bitty on oxygen? And are they jaundiced? Being jaundiced may be a side effect of all of this. Because if the liver isn't fully developed and it needed a little bit more time in the oven, but baby decided, oh no, I'm entering this world right now, and came a week or so early, that means the liver is a week or so slightly behind in developing, and that's a-okay. Listen to whatever your doctor tells you to do about this. Your doctor knows best. Your obstetrician will tell you how to help with it. Most of the time, things are going to be fine. Don't panic. Right. And this also brings us to that itty-bitty little thing that's underneath your liver called your gallbladder, right? Your gallbladder, its only job is to hold on to the excess bile and bile salts that the liver makes. That's its only job. But if your diet is not the healthiest and you have eaten too many cholesterol-y foods, as that bile sits in your gallbladder, it can start to solidify and crystallize, and those solidified crystals can calcify and become gallstones. So if you eat a diet with too much cholesterol, or your body just makes too few bile salts, all of what's just waiting to be used in your gallbladder will end up solidifying into gallstones. Having a couple gallstones isn't that big a deal. What becomes an issue is if the gallstones get big enough to not naturally pass, but they start clogging up the cystic ductwork that connects the gallbladder to things, and then the bile won't be able to be let out, which can lead to infection. Or if so many of these start building up that your gallbladder cannot do its job anymore, may burst, those kind of things. Those are like gallstone attacks. Especially when you're attempting to push it through a ductwork and it won't go. Depending upon why you have gallstones, they may attempt to dissolve the gallstones using drugs, or use lasers or an ultrasound to break them up. More than likely, though, if you end up with a bad gallbladder and everything is blocked off, the doctors are just outright going to recommend gallbladder removal surgery or a cholecystectomy, and they're going to remove your gallbladder. And once they remove your gallbladder, most people bounce right back. It has no long-term effects, all that kind of good stuff, but it can affect how well you process greasy food. If you are eating fatty and greasy food, because remember, your gallbladder is holding on to that extra bile that your liver made, and bile is what lets you digest fat. So you're going to be missing some of the bile that helped you digest fatty, greasy stuff. Right? So the pancreas is the third accessory organ that we're going to talk about. Your pancreas is retroperitoneal, so that means it's going to lie behind your mesentery and that kind of thing. It's about 2% of the actual tissue in it is your endocrine system, and your exocrine system, or glandular tissue, would be 98%. We've touched on your pancreas before. The endocrine portion are the pancreatic islets, or the islets of Langerhans, and they made the hormones insulin and glucagon. Right? The exocrine portion of your pancreas is what we're going to focus on now. Those were the things like the acini cells and that kind of thing. So they're going to help make enzymes and bile and other things like that to help you digest. That's the purpose of the pancreas. Your pancreas produces about 1 liter of bile a day, or secretions a day. That's a lot of liquid. That's half of a 2 liter if you need a visual in your mind of how much liquid this thing is creating. It's going to make a lot of sodium bicarbonate, which is acting as a buffer for gastric juice. So your liver is a major reason why it can neutralize stomach acid. Right? It's also going to create protein digesting enzymes to help digest the proteins that your stomach acid had started breaking down. Yeah. And that's what your pancreas does as far as helping you digest stuff goes. It creates a number, I'm not asking you to memorize all of these, but these are all of the different enzymes and secretions that it will do to help you digest things. So your pancreas helps a great deal, which is why we're worried about CCK and these other secretants here in this lovely image again. Right? Together, your liver, gallbladder, and pancreas here create something called the biliary system, which is all of this ductwork here, through which bile flows and then is secreted into your duodenum. That is called your biliary system. Right? Let's see. I'm double checking everything. Oh, yeah. So, the last thing we need to talk about at the end of all of this is how aging affects all of this. And it's the same kind of thing that everything else. We specifically did mention diverticulosis and that kind of thing. But the older you are, the more likely you are to get cancer, right? Because your GI activity or every activity in you declines. Sad but true. It means that you're going to start producing fewer and fewer digestive juices as you get older. Meaning these organs are going to also become less efficient at absorbing nutrients. Right? All the muscle work slows down, so peristalsis and segmentation is going to slow down. Things like that are going to lead to constipation because things are slowing down and getting stuck in there on the way out. So you're going to have fecal incontinence, constipation, that kind of thing. If you lose control of that external anal sphincter, you may end up incontinent and needing to wear adult diapers. Or some of your elderly patients may if you end up working with geriatrics. And all of this combined can also lead to some malnourishment. So some individuals as they age end up being poorly nourished and losing weight because their GI tract is going downhill and they're just not absorbing nutrients properly. So that is something to worry about or keep track of with our elderly. Okay? But that's everything you guys need to know about your digestive system. I hope you have a wonderful, wonderful day, and I'll see you in the next video about nutrients and all of the chemical stuff I skipped over here.